The National Health Service, known as the NHS, is a healthcare system used in the UK. It is publicly funded through taxes. Lord Carter recently published a paper to Health Secretary Jeremy Hunt stating he believes up to $2 billion could be saved in the NHS by implementing a lean process throughout the healthcare system. Through analyzing the process layout of a typical NHS hospital, we have focused on investigating how to minimize waste in hospitals through the lean improvement process. This is an approach that aims to eliminate waste and improve the general functioning of an organization, while ensuring that there is room for further change and improvement and patients are satisfied. It is not only important to reduce costs for the NHS itself, but if healthcare costs continue to rise, then this means that fewer citizens will be able to afford higher quality healthcare. First, we will describe the current layout of the hospitals. NHS hospitals make use of the cell layout. This is where families of resources are transformed in the same place. After transformation in one cell, the resources can be transferred to the next cell. Patients take different routes through cells of complete processes. The benefits of the cell layout include good variety and mixed compromise, meaning that each hospital has several departments that are able to handle several patients with different cases. Hospitals have an element of a fixed position layout, as the patients have to come to the building itself to get treated, as medical equipment cannot be transported. It can therefore be expensive to rearrange the existing layout of a hospital, especially if more equipment is required. The level of utilization is also not maximized. After speaking to a doctor in the NHS, we have formed a diagram to explain the cell layout in hospitals. The patient moves back and forth from each cell, and there's a lot of waiting time involved at each stage. There are several cases of waste in hospitals. The main examples that affect patients in particular include waiting, transport, overprocessing, inventory, and rework. In the case of waiting, patients have to wait to see doctors, to be admitted, to be taken to the operation theaters, to wait for results, to wait for medicines, and also to be discharged. Most of these are due to time taken for transporting documents and conducting administrative tasks, which in turn delay time-sensitive medical procedures. For example, a great deal of time is spent on inventory due to excess stock in storerooms, meaning patients have to wait to be discharged. One of the main attributes of lean synchronization is to involve every stakeholder. However, it is also criticized for adopting a top-down approach. A solution to this is to allow all nurses, doctors, administrative staff, and even patients to have input regarding the operational functions of the hospitals. They are the ones at the center of the operation and therefore recognize which strategies will be the most appropriate and successful. Taking the example of the Royal Bolton Hospital, they used lean methodology to improve their services by delivering what patients valued as more efficient across the patient journey. They did this through redesigning care if necessary, understanding whether or not services are delivering what patients value, ensuring staff own the system and understand the benefits of it, and understanding what is valuable to patients by looking from their perspective. The overall impact in the hospital was fairly positive, with 96% of patients reporting that the experience was good or excellent, along with measurable improvements in pain management and a 40% reduction in delayed bed days. Implementing the 5S system is a key feature in achieving lean improvement. Sorting requires eliminating all unnecessary resources, equipment, and processes. In a hospital, this would include removing all damaged equipment that hinders processes, along with disposing of all outdated medical resources that comprise the quality of healthcare delivered. This relates to value stream mapping in such a way that management should analyze all the processes and resources and eliminate those that do not add value. Straightening involves arranging all the resources and equipment so that they are easily found and put to use, which as a result saves time. This can be implemented in the hospital through alphabetizing patient files, color-coding medication, or even digitalizing records to save storage space and find information quickly and easily. Shining is similar to straightening. It implies that everything should be in its place and the working environment should be clean according to health regulations, especially in a hospital where this can impact on patients' health. Standardizing ensures that the previous 3 S's have been implemented and monitored successfully, especially into routine tasks such as admitting and discharging patients. Standardization ensures that there is little deviation from set procedures, therefore reducing the risk of any changes taking place that could harm a patient. Sustaining ensures that the 5 S's are made a habit within the hospital, but processes are still being monitored and improved. Sustaining the 5 S's would increase productivity of the staff as a whole, which would in turn reduce costs for the NHS. An improvement in staff productivity by 1% would save the NHS £280 million a year. Pull systems in a hospital would involve signals between departments, doctors, and patients. The signals would pull services between each department when required, rather than before or after to ensure there is no waiting time. In this case, the patients, doctors, and nurses respond to the signal to provide medical services. For example, the transfer of A&E patients to a ward is determined by bed availability. Traditionally, A&E would contact various wards to find bed space. However, this requires coordination between several departments and staff, therefore wasting valuable time. Using the pull system, a ward can simply pull patients from A&E when there's available bed space. This eliminates the A&E staff having to find beds, and they can therefore focus on treating emergency patients. This overall cuts delays, increases productivity, and reduces length of stay, which saves resources. Although lean improvement is necessary within the NHS, it is important to bear in mind that there are some drawbacks to the process. Standardization and people management can result in inhumane working conditions. This is relevant to the current issue with the NHS, where doctors are working excessive hours without receiving an appropriate salary. More specifically, within the NHS, only specific lean tools are mainly applied, such as Kaizen Blitz and rapid improvement events, which tend to produce small-scale and localized productivity gains as opposed to sustained long-term improvement. Although this suggests that lean might not currently deliver the efficiency improvements desired in policy, the evolution of lean in the manufacturing sector also reveals this initial focus on the tool level, which could represent a misuse of the system as it breaches the assumptions behind lean. Lastly, healthcare is predominantly designed to be capacity-led, and hence there is limited ability to influence demand or make full use of freed-up resources. One of the main types of waste in hospitals is waiting. A solution to this could be the computerization of all information through an online platform. If every citizen had a profile with all their medical history, when a patient arrives, doctors will immediately be informed of their medical history, removing the steps of preliminary questionnaires. Furthermore, this platform would prevent the criticized top-down approach. A comment section could be added to the platform in which staff could comment on the treatments to adopt. Anyone could leave a comment or a recommendation, and this would ease the decision-making in the future. This platform, however, would have to be simple and clear to abide by the straightened component of the 5 S's model. Lastly, the NHS could limit working hours and have more frequent shifts for staff. This would prevent complaints of poor working conditions and create a more focused and high working quality environment.